strips of this. So one goes from one side to the other side. So that's one. Yeah, and then if I just put one next to it. So white stuff just protects the skin, because you might leave this on for a few days. And there's normally like a split in this, so you can just peel that. Like so. And if I just apply this, so I'm going to put this one, so think about the patella, so this is inferior pole, superior. You might have 2 or 3 strips of this, so that's one of them there. So there's no tension on the tape, it just lays down. That's one done. And if I split this one. Then I have this at a slight angle, just to cover the whole of the knee, like so. So it's covered with ligaments, you see that? Yeah. And you could say where I cross the tape is roughly going to be, give or take, the centre. Sometimes I put a little dot and just mark it so I know where I am. Now what we're going to do, because the idea would be to try to activate this muscle on the inside, just tense your cord. Okay. So not the best. Yeah, on that one. So we could try to tape this to try to get this working. Yeah, and relax there. And if I put a relatively small piece, you should be able to perforate. So people struggle to rip this. It's using up to rip that tape. So put that in the centre. Don't do anything, if that's okay. And then so from there, the first one I call it the tilt. So what it means is it just tilts it. Just watching. Okay, so I just pull it. Okay, and I just angles it, tilts it down to that medial side, so it's already drifting medially. Now the second one will do the work. So the second one is a little bit longer, so this goes on the lateral side of your patella. And what I do with this one is a pull and a push, so I push it. Okay, so I push it there. Okay, so I push, and then with the tape I pull, like so. And if I see a crease on the inside, see the crease? And I know that I've pulled the patella medially. And I might be tempted to do a test on that then. I might say to the patient, stand, bend, does it feel better? Yes. Try the stairs, does it feel better? Yes. Then what I sometimes do then, I do like a fine tuner. If she says yes, it feels great, then I probably would put one more strip over that, and I would just literally keep it in place there. If she says to me, I'm not really sure, it's still a bit achy, then I might be tempted to push it a bit more, or I might be tempted to pull it back. Or I might be tempted, if I notice a patella, let's say it seems to be rotated like that, we'll call it lateral, and I might be tempted to rotate it medially and use the tape to guide me around there. See that? So I'm rotating it around, and that's will hold you in that position there. Now that could mess up the knee in that one, but you can use it to rotate it, that sort of thing. Then once you've done that, I'd then put 2 white strips over the knee, and I'd leave that on for a day or 2 or 3, that sort of thing. It does look a bit messy with when you shower and stuff like that. It does stay on though.
What if you've got really tight up